Okay, so the next thing we're going to talk about is if a child is wheezing, if they're coughing, what do you do to try and stop the wheezing and coughing? What happens when we're coughing? Oftentimes we have our mouth open and our airway started to get sensitive, very sensitive, they become hypersensitive. And you start to feel a tickle and then you start coughing. And how do we calm down the cough? Because the more you cough, you start taking big breaths, and as you take big breaths, it contributes to the next cough. So we want to try and keep your breathing calm, and it will stop the cough. So wheezing is the same. Initially when you're wheezing, Keen, do you wheeze? Do you wheeze? You do. When you feel wheezing, you feel a little suffocation, you feel that you're not getting enough air into your lungs, and when you're not getting enough air in, the natural instinct is to draw more air in. When you feel there's not enough air coming into your lungs, you feel like breathing heavier. But what does the heavy breathing do? It makes the airways more sensitive. The cause of our wheezing, the cause of our coughing is over-breathing. How would you know when you're over-breathing? You're over-breathing when you can
hear it.
Oh, when we can see it.
And when you can hear it.
When you can hear it. And what's the third factor? How else would you know if you're over-breathing? If the mouth is open. Those are the three things. So if you can hear somebody's breathing during rest, are they over-breathing?
Yes.
If you can see their breathing, if we were looking at your movements and we can see breathing, are they over-breathing?
Yes.
And what else? What's the third one? If
you're breathing through your mouth.
Through your mouth. You're taking cold, dry, unfiltered air. Asthma comes in, cough comes in through the mouth, wheeze comes in through the mouth and irritates the lungs.